Hey, good morning, folks. I think I'm going to get started. It looks like we're a little bit late gathering this morning, but that's okay. So these are the usual reminders we go through every week. Please don't disclose any private health information during your case presentations. Usual contact information for Rick and Andy and myself. And some information about cardio. It's hard to believe we've been around for 7 years. And this is the cardio team. This is a range of practices, of course, from across the state. And today I'm going to be presenting on food sources and food environments. And then we have discussed, since I looked at the case that Paul presented, really fascinating stuff. I think that I don't see Mary Lee on, but I think Danette and Karen are going to be able to do this case a lot of justice. I have a few comments as well that I want to make before we get started with that, based on my experience, and I hope everyone's able to participate in this particular case discussion. So let's get started. These are disclosure statements. There's nothing new here. And let's talk about food environments and health equity. I've been in this space for a very long time. Early 2000s, I was the director of the Pediatric Obesity Center at Children's Hospital of Pittsburgh, in the Department of Pediatrics. I was the former chair of the American Heart Association's Obesity Committee, which is a multifaceted role. It's not just scientific, it's also about advocacy as well. I testified in Congress about trying to regulate competitive foods for school lunches. You can look that up on YouTube. So, you know, the lunch that many of you have children, I'm sure, the lunch that is served, you know, the standard is approved by the USDA in terms of its nutrition content, but to make extra money, schools sell burgers, fries, candy, etc. And those are not regulated at all. And if you're a 10-year-old kid, imagine which ones are more appealing. So Mrs. Obama wanted to do something about it. Unfortunately, the effort went absolutely nowhere. It was a failure, but we may revisit it again some point. I mean, I know the country has different priorities now. So I've been an advocate for healthy food environments, which is my point, for probably 2 decades or more in various forms. So this morning, I want to talk about food deserts, the role of food deserts, and a lot of skepticism that's been cast recently about food deserts, and food justice as an alternative strategy to encourage consumption of healthier foods. We'll see if that plays out well. So what's a food desert? It's an area where it's difficult to buy fresh, healthy, nutritious food. And the opposite of that is a food swamp. It's an area where unhealthy food is widely available. It's not hard to find these places. Driving in from the eastern suburbs of Cleveland this morning, you pass through some definite food deserts where there's every single calorie comes from a gas station, a convenience store, or a fast food restaurant. And that's not unusual in many, many urban areas and rural areas as well across America. So those are food swamps and food deserts at the same time. It doesn't have a really precise definition. It's basically based on perception. Okay. So food deserts exist, but do they matter? It has a lot to do with income and class than with geography. I know Jim presented information on smoking cessation. It's kind of heartbreaking that Medicaid recipients are spending $2,700 a year on cigarettes, and I'm hoping none of us are spending a single dime on it. That's a lot of money, right? That the poor are spending on something that is destroying their health. So it's true that we have food deserts, but remember, if you're a small business owner in a community, let's say East Cleveland, and I'm sure in the cities in which you live, there are comparable communities, and you have a small store, you're going to stock foods that people want, right? And, you know, fresh food and produce is very difficult to keep on the shelves, especially if people aren't buying it. It's very expensive. It's hard to source, etc. So it's a little bit of supply and demand, but we'll get into that a little bit more. And it has a lot to do with income and class. The challenge that we have is if you build it, they may not come. I was a big fan, and I know that some of you have participated in another ECHO program that I run at the University of Chicago. I'm no longer involved with that, but we had lots of discussions. We have a similar talk where we talk about the Whole Foods being constructed in Hyde Park in Chicago, which is actually the neighborhood in which the University of Chicago is. It's a food desert. It was a food desert. So everyone was excited. Whole Foods is going to transform the food landscape of Hyde Park. The poorer communities around the university will finally have a source of fresh, healthy food and a source of employment. That has happened. The employment part has happened, but I was joking that when I went in there one day, the only people I saw were professors at the University of Chicago buying, very expensive foods. So it may not solve the problem, and cost is not the only thing. So there are comparable things. I know Meyer is building a much more cohesive and much more rational approach to a supermarket here in the Fairfax neighborhood, which is just west of where I am now at Cleveland Medical Center. And that's an underprivileged area as well. So the problem is that if you build a new neighborhood supermarket, it doesn't change what people eat. In fact, and this is a few years old, they probably are able to buy the same foods they normally buy at lower prices. And so this is a really difficult and intractable problem. So it's often cast as this political problem. We live in a food desert. We need a supermarket, and there's a lot of lobbying that goes on. That lobbying gets to the municipal level in a city like Cleveland, Cincinnati, Columbus. This is a poor neighborhood. We need to do something about it. And then Giant Eagle or whatever you have in your area says, okay, well, we'll put a supermarket there, but you're going to make it worth our time. And then they start to give away some pretty sweet deals: free land, no property tax, whatever it is, sometimes for 10, 20 or more years. And of course, that's going to provide an incentive. And the moment that they find that they're not making a lot of money, they pull out. And so this is a pattern that's been repeated across the country, and I think it's a shame that that's it. But it's seen as a solution to a problem, but you're not really getting at the core issue. What determines what we eat? Its taste is number one. If I offered you something that you really don't like right now, it doesn't matter how much it costs or how healthy it is, you're not going to eat it, right? Taste is number one. Cost and convenience follow. And then health is way down the list, especially for our low-income patients, okay? And there's lots of reasons for that. We'll talk a little bit about that in a moment. So taste drives what we eat. So when does this develop? Unfortunately, it develops at a very, very young age. I say unfortunately because by the time a child is old enough to tell you what he or she likes, their taste preferences are established. And this is a newborn baby girl, how she's responding to sweet. You can see a little smile on her face over here. Bitter, not so appealing, and just the habitual state. So it's really, really early on. So and we all have certain things. Both of my parents are immigrants from India. The food, it was much, much spicier than what I was, accustomed to in the community I grew up in. And I've grown up with that. I can't change that now. If there's not a lot of flavor to it, I just can't eat it. And that's true of other people in other communities and other cultures as well. So what determines, now we talked about taste, what determines what somebody's weight is? Well, is it really the presence or absence of a supermarket in the community? That's way too simplistic. It's a lot of things. So gender, birth weight, temperament, early feeding style, early flavor experience. You can see this. These are really, really important very, very early on. And then there's palatability, there's economic status, then there's other things that continue in the family, and then there's a genetic predisposition. So, you can say that, well, if we had healthier food choices, things would change dramatically. That's just simply not the case. So here's a thought exercise when we talk about food justice. Now, the classic experiment in food choices comes from Burlington, Vermont. It's very old. It's from the 1980s. Burlington is a prosperous college community in northern Vermont, not very diverse, but nevertheless has a lot of people who have economic challenges. Almost all of the inhabitants are white, but there's a lot of, Medicaid recipients, a lot of poor people in Burlington. And they had a food bank, and the food bank normally gets donations of plain white bread. $1 a loaf is what you'd pay for it in a supermarket back in those days. So for a few months' time, they got donations of artisan bread from a local bakery, which is just very kind of them. And the owner of the food bank put those side by side, the white bread that cost $1, the other one that probably in today's money would be $8 a loaf or something at Whole Foods, just incredible, expensive. And he wondered what people would choose. So remember, there is no convenience difference. They're side by side. There's no cost to any of the clients. They're all low-income clients to either choice. And overwhelmingly, the $1 white bread was chosen because of taste, because of the taste. So the notion that we just provide healthy food to people, they're going to eat it, is not going to work. It's never worked. It's just a, and you'll never really get over a food desert. If you put one supermarket in there, they'll say, well, their hours aren't great, or you have to need another one. It just goes on and on and on until you'll never solve the problem and you keep repeating the same mistakes again. So let's think about something different. So this looks pretty appetizing, I think, to a lot of people. We did this a couple of years ago at Echo, maybe to some of you. These are desserts prepared by a catering company. And let's say you've had, you were starving, right? You're at a meeting or on vacation somewhere, and you missed the lunch, and this is what was presented to you. Probably looks pretty good. The question is, would you eat it if you knew that the woman who ran the catering company was her? This is a woman who used racial slurs against Mexican Americans, called them whores, et cetera, et cetera. If I told you that in advance, would you still eat her, whatever those things, donuts and chocolate squares, et cetera? It's hard to say. I think most of us would say, I don't think I want that. But Misty D said, no, would not. I wouldn't either. And I can tell you, it's not because of some great rational thought process that's going on in your head. It's very visceral to what's going on. Okay, it's very, very visceral. It's like, oh no, it's because she made it and she's an undesirable person. She made it and she's mistreated people. It's all of those things will immediately bubble up to the surface. So rather than saying, look, hey, which I think, by the way, I think the opposite approach is very patronizing. It's very patronizing for me to say to somebody who is of low income, who is coping with obesity, type 2 diabetes, heart disease. And I know Jim and I would never do this. He goes, well, it's really easy. Why can't you just eat healthier? Why are you eating that stuff? No, we never do that. It's very patronizing for us because people eat it for lots of reasons, whether it's emotional or it's economic or it's taste or it's culture or whatever. It's not really our place to go after changing people's habits from that standpoint. So let's try a completely different approach. And let's talk about that now. Food justice. The term food justice has multiple meanings. There's not a lot of consistency in the literature. Most of the time, the origins of the term refer to agricultural workers, mostly in California. So food justice seeks to ensure that the benefits and risks of where, what, and how food is grown, produced, transported, distributed, and accessed and eaten are shared fairly. Requires transformation of the food system, eliminating disparities and inequalities. So food justice, communities exercising the right to grow, sell, and eat healthy food. Okay. But there is a little bit of de-emphasis upon the eating part and the health part, and more on how we treat people, many of whom are undocumented, who are working in tough conditions, how we treat them and how we grow our food, and what chemicals are used, et cetera. But there are 3 pillars, nevertheless: healthy food for all, sustainable food systems, and justice for food workers. We don't have to focus on all of those things. I think, I certainly believe in justice for food workers. I believe our agriculture has to be sustainable, but here in ECHO, we're dealing with health, right, for the most part, not so much with the other two. So we talked about the drivers of consumption. These are all relative. Taste overwhelms everything else. If something doesn't taste good, doesn't matter what it costs, doesn't matter how healthy it is, people will simply not eat it, period. Convenience is number two. How many of us have patients who say, I go through the drive-through, or they have little kids at McDonald's after work when I'm really hungry? It's something that a lot of our patients do. Price is comparable to convenience. Sustainability way down the list. Okay. Youth, we think, people from the upper middle class, I'm going to buy organic food, or I'm going to make sure the packaging is not too robust so that it doesn't, that's a tiny, tiny proportion of the population that has that particular set of values. Most people have other priorities that overwhelm that entirely. Social justice has not been seen as a driver of consumption. Now, I'm not an expert in this area, and I don't have time to devote myself entirely to it. I wish I could, but I think it has the potential because people are motivated by social justice. We saw that with, over the last few years, we've seen lots of movements that have had a significant impact on how we perceive our society. So it's worth a try. And I remember saying this to when I was in Pittsburgh for a long time. That was a community called East Liberty, and I don't know if anyone has been there, but East Liberty has transformed itself incredibly. It also has a Whole Foods, etc. But when I first moved to Pittsburgh, there was no place to eat except McDonald's. That was the only restaurant. It was a really decrepit McDonald's too. But the residents of East Liberty had successfully lobbied for better public transportation. There were charter schools they had lobbied for successfully, mitigating lead in old housing in Pittsburgh, rodents, very, very effective. So I asked one of the community leaders, so why is McDonald's the only source of food in your community? And he didn't really have a good answer to that. So if you believe in social justice, doesn't it apply to every aspect of how we live? And food is part of that. So maybe that's another approach we can take. So the definition of insanity, you've heard this quote many times, I'm sure, is doing the same thing over and over again and expecting different results. So these supermarket food desert mitigation efforts, unless they are well structured, so the mire that they are building is going to be more of a social gathering place with other services. They are going to stock food that people like, as well as food that is healthier as well. It's not going to be an elite place at all, and that's right. But most of the time, we don't do that. So if these are common statements, if only there were healthier food options in poor communities, it doesn't work. It's time to stop shopping for supermarkets, tax break. Washington, D.C., this is one particular example. Elwood Thompson, I don't know it, but it's a high-end organic grocer, wanted to move to this economically challenged neighborhood in Washington, D.C. And as most of you know, Washington, D.C. has a lot of economic challenges beyond some of the more elite areas. I don't know how big the store is, but I think the property tax would be approximately $250,000 per year for the store. They get 10 years free, $2.5 million. Where does that money come from? It comes from the taxpayers of the district, $2.5 million. Here, take it. That doesn't sound like justice to me. It sounds like a complete, and remember, the goal is to bring healthier food to communities. We don't believe the residents are going to actually shop at this high-end grocer, or going to, if they did, they're not going to purchase the healthier food. So this is a big waste of money. There's another article if you want to read why convenience stores don't sell better food. They don't sell better food because people don't buy it. If you're a convenience store, you're going to sell what people want. And fresh fruits and vegetables are not high on the list. Here's an example at a small grocery store in Northeast Washington. Nola Liu, who's a community outreach officer. All of these people are very well intentioned, by the way. She works with DC Central Kitchen, World Around the Deli case, and she made cinnamon pear crisps and offered them to this gentleman and on his way out. And he asked, "Are you going to make it for me?" He asked, and she said, "No, she's not going to make it for you. He's just giving you the recipe." And he said, "I'm not much of a baker." He said and walked out, and that's pretty typical. Okay, I think that this sort of these well-intentioned, this is probably a very young person, I think should be congratulated, but I really wish they would kind of focus their energy in some of the more justice-based approaches. Healthy food is not more expensive. It's $1.50 more per day. And that's just the actual cost of the food. Driving to McDonald's, the gas, the time, everything else puts you over the top. It costs more to eat unhealthily. We have no idea how much our low-income clients, what proportion of their income is spent on food is much higher than people of the higher income. They pay more, by the way, for the same things. A box of cereal costs much more in a small convenience store than it does at Costco, for example. So, and I did an experiment way back when, because I had all these med students. It was a young med student. I said, I had to pay him to do this, of course. Do two things for me. I want you to spend a week and line up at your favorite fast food restaurants. You get $10 for lunch every day. See how much time and money it costs you every day. Add that up. And then I want you to make your lunch at home, and a healthy lunch at home. And I want you to count the amount of time and money you spend. There was no contest. He was at Chipotle for 35 minutes at 12 noon, because that's when people eat lunch, right? Before he got something to eat. It was no comparison at all. The cheaper, healthier option won out every single time by a long shot. I simply don't have time to cook and have to deal with a lot of stress. Yes, that is true. Food preparation time in the 1950s, before I think most of our time, was a couple of hours a day. I don't imagine too many, and it was all women, of course, back then. I don't imagine too many people putting in that kind of time. Now it's down to 13 minutes for a middle-class family. Many families and many of our clients, it's probably 0, right? But the amount of time required has not been astronomically. It's not that we have gotten so much busier. I think that we have deprioritized cooking to a significant degree, and I'm not going to get into the details of this this report, but people who have very demanding jobs actually spend more time cooking than those who have other types of jobs. This is another aspect of food justice. So, rather than dispensing with those arguments, when someone says, "Gosh, this is terrible, we don't have healthy food in our communities," it goes, "Yeah, that's true, but let me present some ideas to you that might be different," as the way to approach it, because people are very invested in the idea of food deserts, right? You're not going to dislodge them from that. But you can talk about food justice, I think, in a way that's important. This always makes me very angry. So children are the targets of a lot of advertising. And it's like cigarettes. You want to get them hooked early, right? So this is Black targeted TV. Now, Black targeted TV is programming that is watched mostly by African Americans, but African Americans mostly don't watch that. They watch everything that everyone else does, but there are nevertheless these kinds of things, and it tells you the brands that advertise on these channels and these programs and how they're increasing their advertising. Why are they doing that? Because middle-class people, whatever race or ethnicity, are eating less of their stuff, so they got to double down on the clients that they think they can hook, right? So it's like smoking. If upper middle class people they must have quit smoking in large numbers. So why not market cigarettes to the poor? Because that's where the money is. And that's what's happening here as well. Pretty disgraceful. Junk food ads overwhelmingly target Black and Hispanic kids. Overwhelmingly, okay? Where I live, there's no McDonald's, there's no fast food. They would never allow it. And I don't think some of the kids my daughter plays with have ever been to a Burger King or I can't remember them ever talking about it, right? They just don't. So, but this is what they are doing. This is how they are marketing their food products to people that are vulnerable to it, right? I mean, if you are a 6-year-old kid in a poor community and you see an ad for whatever it is, Yum Brands or something that's unhealthy, whatever it is, you don't have a lot of knowledge about health and nutrition. You're going to bug mom or dad until they get it for you, right? So this is why they do it. And that I think is a shame. So how fast food became black. This is a really interesting book. I think I'm not going to get into a lot of detail about it, but it's not just that children are being targeted. A lot of franchisees are African Americans as well. They have the interest and they have connections to the communities in which they live. And that's become a big issue too. So let's rethink food justice in a way. So food justice original definition was all about sustainable agriculture, protection of workers from pesticides and those kinds of things, which I think is wonderful and very, very important. However, as people who are clinicians or work in a clinical environment, let's focus on that healthy eating part and let's empower our patients with a few basic statements. It's not what you eat, it's what else you eat. And Jim and I face this in Fit or Me all the time. I ask the question, what do you drink when you're thirsty? Do you drink water? Well, I drink a lot of water. No, that's not what I asked you. It's like, what else besides the water? That's where the issue is. So it's READ is my acronym, recognition that food that is highly processed and high in fat, sugar, calories has been deliberately marketed to populations which suffer disproportionately from obesity and its consequences. And I don't know which session it is, but we have a picture of a secretarial academy from Mississippi in the 1960s, all Black women, all of them thin. And then you show the same picture 30, 40 years later, and there's a big change. That's not genetic, that is marketing. That's food justice at work, or lack of it. The E is for empowering consumers to make choices not only based on primary drivers. So the primary drivers are taste, convenience, and cost. Okay, that's what determines what I choose to eat. Taste being number one. If something costs a bit more, but I really like the taste, I'm going to buy it, even if I'm of low income. But also on the basis of fair and just marketing practices, okay? Recognizing those that are taking place. I don't know how many of you remember a children's television network called Cubo. Anyone remember Cubo? It's owned by NBC. Let me send you a link. So I developed the advertising guidelines for Cubo. Cubo was the first television network in the United States to regulate ads to children based on nutrition. And I'll send you the work that we did with them. I don't know, it's 2006, 2007. It was voluntary. So Cubo adopted them, but we sent those guidelines to the other networks and they say, yeah, we'll take a look at them, but they didn't actually implement them. The whole effort, I think, kind of fell apart, but that was about 15 years ago. But that was something that I think we wanted to do. So there are two parts of it. Okay, Cubo will only accept ads that have foods with a certain nutritional value. But I wanted a corollary to be, I want to educate kids about the nutritional value of foods as well. So they did do some of that, but Cubo was not a hugely popular children's network. So the A is advocating for healthier food from existing sources, not building new supermarkets at huge costs, but healthier food in schools, etc. And here is the most important thing. It's not what you eat, it's what else you eat. Just say no. If you think that something is unfair at any level, first of all, are you targeting me because I have a certain appearance or I belong to a certain culture? I don't want that. Are you targeting me because you think you can get a lifelong customer out of me? I don't really want that. Are you targeting me because I may not know that the people who grew this food are being abused in some way as well? So just say no to it. And most of the time, it's going to be pretty obvious what we're dealing with. So learning and thinking about unjust marketing practice, empowering asking questions about why and how specific foods are marketed to specific communities. Does your snack need to be so high in sugar? Okay. No, thank you. Not only is that a poor beverage choice, but I don't like the way the company targets people in my community. Yeah, that's something that we don't often do, and I think we ought to do that a bit more. Okay, thank you. I'll take any questions here.
I do have a question, and good morning. It's about taste, and is there has there been any research done on changing taste preferences? Because I mean, just even from personal experience, that can happen. Because foods that I used to like, I mean, like that table with all those desserts, I'm like, okay, what comes to mind now is like, man, my stomach's gonna hurt. I'm gonna feel tired. I'm gonna fall asleep. I'm gonna have brain fog, and I don't think I'll pass on that, and drink more water or something. Whereas one point in time, I'm like, "Whoa, wow, let me have a sample of this or that," or So I just would like to know
Yeah,
if you've
great,
seen.
great question, Danette. So
Mhm,
taste preferences, the three tastes, bitter, salt, and sweet,
mhm,
very, very difficult to change. However, that's not what the approach that people take. We
mhm,
make healthier foods that simulate the taste of the palatability of the things that we used to like. So that approach does work. So have you ever had these cauliflower crust pizzas? They taste pretty close, right? But they're much lower in calories because cauliflower has lower calories, but it's the same taste. What you can't do is if the experiment is if you ever travel to a different culture, a different country,
mhm.
and start to eat things that are completely unfamiliar and have a different ratio of those sugar, salt, and bitter tastes, you're not going to be able to really, as an adult, it's very difficult. So it's the food system that has to change. We can't change our own genetics, right? So
Mhm.
they have to start to cater to us. That's what a lot of organizations do.
Okay.
It, Dr. Rao, this
Yeah.
Paul, as always, so many thoughts going, again, fascinating presentation, so many thoughts swirling through the back of my mind. I'm glad you pointed out the way the marketing is targeted. I was aware of the fact that in the southeastern portion of the United States, some companies would not only target certain ethnic populations, but the food that they would prepare for certain ethnic populations was different. As an example, food targeted for Spanish American populations had a higher fat content than the food that was targeted to other populations, which is kind of a scary thing. I apologize. I don't remember where I heard it or learned it, whether it was here with you guys or somewhere else. But I became aware of the fact that it's possible for humans to change their taste preferences. It takes a couple of weeks. We've suggested we do some diabetes education classes here at Southeast. We suggested that to some of our core members, and we've gotten some positive feedback. They said, "Yeah, Paul, I was skeptical when I heard you say that, but I tried something. I've forgotten what food item it was, and after a couple of weeks, I started to like it a little bit more." So not to contradict what I've heard, but maybe offer some evidence that
Yeah.
it can
So
be successful.
that does work. So for example, if you say, and we do this in the Fit or Me program all the time, I want you to drink just water for several weeks. And it's, oh, I really can't give up my pop. Okay, just give it up for a few weeks. And then I don't do this with the adults so much, but because you don't want them to get them back on pop. I used to do it with kids in the pediatric center. They said, okay, because we had pop. I said, I want you to try this pop. How does it taste to you? And they said, oh, it tastes far too sweet at this point. I think that is potential. So you can get used to something that doesn't match those particular, if you abstain from it, right? I hate to keep using the analogy of cigarettes, but if you quit smoking for several years, it's not as if, okay, well, you're okay. You've changed your lifestyle. You're not smoking anymore. But if we offered you a few cigarettes or your friend offered a few, you have to fear that you'd go back to those original preferences as well. So what I think is harder, Paul, is if you really are like something to just kind of, and it's always available, and you don't have the opportunity to abstain, to really refrain from eating it is not easy to do. That makes, okay, thank you, Karen. Thank you, Paul. Thank you, Danette. Great case. Just back to Andy for a minute.
Just a final reminder that our cardio webinar is next Wednesday, and you can register on the cardio website or through the QR code. All past and present echo clinics can be found on our website. Next slide. And then just a reminder that a post-clinic survey was sent to you, and please have that finished by tomorrow at 5. I sent out a case study schedule along with the slides this week. Please let me know as soon as possible if you can't make your presentation date so I can change that beforehand. And if you have not submitted cases, please go ahead and submit extras or submit the ones that are missing so we can fill out that schedule completely.
Take care and have a great day. Bye-bye.